My name is Michael Walker. I'm the facilitator of the Safe Food LGC Food Allergy Food Intolerance Network. And that's a social media network at safefoodallergy.ning.com with over 400 members with an interest in food allergy and food intolerance. Food allergy is a problem. It's a big problem for people who have it. It's a problem for businesses because millions are lost every year in allergy incidents and recalls. And it's a problem for the health service. My interest in food allergy started when I was a public analyst doing the measurement science that underpins food safety and food standards enforcement. My interest was further kindled by association with Hazel Garland, herself allergic to peanuts, and she was working at the time as an advisor to the anaphylaxis campaign. I was part of the Food Standards Agency. She was lobbying me for support to do better things for people with food allergy, and we started to work together. So we're currently looking at a set of cases when people die, and that's something that happens very rarely, but people do die from food allergy anaphylaxis, and inevitably then the courts get involved. So what we're doing is looking at the attitude of the courts in the UK to fatalities and serious incidents involving food allergens. There's a link here, we think, with food fraud. Some of the cases are on a spectrum from accidental contamination, negligence, through to deliberate adulteration of food. For example, one of the first cases we looked at was the death of baby Thomas Egan in a nursery. And there were lots of errors. And it's good to report that that nursery group and childcare nurseries in general have learnt from that. And there are now rigorous procedures in place, good training, and children are safe. Children with food allergies are safe in nurseries. But we also know that takeaway, catering, meals, they're a big problem. Richard Pumphrey and Hazel Garland have published extensively on this. And anything between 30 and 75% of the food anaphylaxis deaths that do occur in the catering sector. One of the most worrying things that we've come across recently is an example of where people are adulterating almonds with much cheaper peanuts. And there's been a prosecution, and what happened there was that as part of a survey, training standards officers were looking at the sorts of meals which could possibly be bought in takeaway outlets for people with peanut allergy. And they found two examples in Cumbria where the takeaway proprietor was adamant that his meal was fine for someone with peanut allergy, and having said that, peanut was found in the meals. And this was traced back to a supplier who'd been adulterating the almonds that they were selling with peanuts, and they were convicted and fined heavily. So I presented these cases to Professor Chris Elliott's conference here, ASSET 2014 at Queen's University, and there's been a lot of interest, and Professor Elliott has expressed interest in working with Hazel Garland and I in tracking down some of the threads of the investigation of where this adulteration has occurred. Is it still occurring? Is it likely to happen in the future? In fact, has criminality crept into the supply chain to the detriment and possible danger, risking death for people who are allergic to peanuts?